My name is Aldi Simone from Sports Medicine Associates of South Florida. Today we're going to talk about ACL anatomic reconstruction. Here's an ACL stump with torn tissue. I'm probing it. Now you can see we're cleaning some of the stump, the base on the tibial side. We also do this on the femoral side to identify our landmarks. Here's a nice imprint of where the graft should attach. Now we will identify the insertion on the femur and mark it with a bovie. We're going to clean the proximal tibia to make sure that we have a good anatomic visualization, and again mark this with a bovie so we know exactly where we're going to drill anatomically. Here you can see a guide that we use externally. We also use fluoroscan to create this initial site, and then we're going to use a drill to drill on the tibial side first. We're going to use a shaver to clean that site to make sure that we remove any of the debris. We'll use some dilators now to dilate up to a certain size. This also compacts the bone and it allows us to extend the knee to make sure we're in a good anatomic position. We're going to make a medial portal approach. We bring in a guide on the femur. I'll flex the knee to about 145 degrees and we use a special guide with a drill bit. With our guide in place, we're going to place a stylus, which will allow us to place a drill over that. We can drill the femoral side. We drill it to a depth of about 25 millimeters. I will then use a hand shaver to clean the tunnel to get the debris out, just so we can pull the graft into the knee. And now I'll use a special marking device, a bovie again, to make sure that my screw is in a good position. Dilators are very helpful. It allows us to look at the measurements as well as to compact the bone for excellent fixation. And now we're going to take a K-wire, once again with a suture attached to it, and pull it inside the knee, and this will allow me to advance my graft. Here we're pulling the graft into the knee. You can see the dilator once again to smooth the bone and compact the bone. We're using a probe now to pull the sutures in. Here you can see the proximal portion of the graft, the bone plug that's going to fit well within the femur in an anatomic position. We're going to guide that in with our sutures as well as our probe to make sure that seats properly. We're going to advance that slowly to make sure the position is in a good anatomic position. And then we place a guide. We'll create a little notch for our screw. And then we'll use a protective device, which is a metal device. When we place the screw, it always protects our graft upon insertion of the screw. These are titanium screws. I think they're excellent. They're with great fixation. And now we're going to see a final image of the graft as it's seated nicely, aperture fixation with the graft in place. The graft is seated. You can see full extension is obtained. There's no wall or notch impingement. The graft is also fixed distally in the tibia as well with a similar screw for an anatomic reconstruction. For more information, visit draldisimone.com. Thank you so much.